All right, so you've gotten through the SANE screening, the approach and introduction, the full screening, the initial consent, and now we're on the release of records. So we're about halfway through the initial assessment. The release of records section is meant for participants who may have received care elsewhere before arriving at the SANE or being discharged to the SANE. So, for example, if someone was treated at an emergency department and then arrived with the SANE nurse for care, then we want to make sure that we have documentation of that care. And there are a couple of reasons for this. One is that if a person received medication before they got to you, well, we're asking them about their pain. And so if they were seen a few hours ago in an emergency department and then were discharged for their SANE exam, that might have an effect on their pain score. And so we just want to be able to control for that. If they did receive medication, we want to know so that we know whether their pain score is accurate based on, the injuries they had. So this would be for anyone who is in a clinic-based program who always gets referrals from the emergency department, or a SANE clinic that doesn't have records that are linked to the emergency department's records. So if you're within an emergency department and you have access to the person's medical record and it's combined with the SANE record, that's fine. But if they're not combined, then you'll want to get a copy of the history and physical portion of the emergency department record. And so what I mean by you'll want to get a copy is we will ask for you to have the person fill out a release of records form, which I'll show you in just a minute. And once they've filled out that form, you'll fax that to UNC and we will request the record for you. The discharge paperwork is usually not sufficient for that, so just make sure that if you do just save the discharge paperwork, that's fine, but make sure that if they received care before, you also get permission to get the history and physical. So the information that we need to know for the release of records is just which healthcare facility they were seen at, the phone number of the healthcare facility, and also that the UNC release of records form was filled out, and there's just a little checkbox there. And then you'll just scan and email securely or fax the release to me, and we'll request the records at UNC. The next section is the release of records page. This page gets completed for every participant, and you'll ask, or you may already know, whether the person received emergency care at another facility before arriving at the SANE clinic. If the participant comes with discharge paperwork, that's not enough information. We need the full medical record, so please ask for the release of records to be filled out so that we at UNC can request the paperwork from whatever facility they were seen for care. So if you find out that the person was seen for care before they arrived at the SANE clinic, click yes. So at this point, you'll fill out a release of records form, which can be found in your initial assessment packet. At the top of the page, go ahead and fill in the name of the other facility and try to be as specific as possible. If you use an abbreviation in your community, go ahead and spell it all out here, because at UNC we'll be able to find it more easily. The next section, you just fill in the patient's contact information, their date of birth, and underneath that, you'll put in the dates of service. If the person, for example, is with you today, but they received emergency care yesterday, put yesterday's date and the dates of service, because you want the information for the emergency care record related to the assault from that facility. The next section, other, is checked for you, and just go ahead and fill in the date here that you put in the dates of service as well. If for whatever reason a participant was seen over the course of 2 days, for example, they came in at 10 p.m. and were kept until after midnight, you can go ahead and put both dates just so it's clear. The next sections are all filled out for you. The release is good for 1 year, and you can mention that to participants if you desire. And the last section, you'll just have them sign, print their name, and date that section. At this point, you can put this form aside and it can be faxed or emailed to UNC later. So at this point, it's a good time to pause and you can go ahead and practice the release of records section on your own.